Reopening Connecticut while warning about a potential surge in cases this fall and winter. The governor, New Haven's mayor, and health experts answered questions at Yale School of Public Health, highlighting what went right and what they would do differently. Channel 3 New Haven Bureau Chief Matt McFarland has the story.
Addressing students and staff here at Yale School of Public Health, Governor Lamont says state residents have done a great job keeping the number of COVID cases down while slowly reopening the state. But he cautions it's not over by a long shot.
Connecticut's been a leader. I mean, we're more likely to wear the mask than just about any state in the country. And that's made an enormous difference.
Governor Ned Lamont says just look at the numbers, stating that for the last 90 days, Connecticut's COVID infection rate has been around 1%. But he's quick to add, people can't get too casual.
Because this is the beginning of something, not the end of something.
Lamont and the chairs of the Reopen Connecticut Advisory Group, along with New Haven's mayor and health director, took part in an hour-long question and answer session this morning on Connecticut's coronavirus response and its reopening. So what worked? They say the regional approach with neighboring states, along with closing schools, restaurants, and non-essential businesses early before slowly reopening in May.
When we decided that we have to prioritize economic health and sometimes and public health and other times, we also had to make sure that anything we opened had the appropriate safety protocols.
As for if there's anything he would have changed, New Haven Mayor Justin ELICKER questioned whether they could have done things differently to help protect those in nursing homes. 63% of the state's COVID deaths involve nursing homes and assisted living.
Again, it's in hindsight, but I think that these types of decisions will weigh on many of us for a long time.
The panel also touched on the likelihood of a surge in cases as it gets colder this fall and winter and people start spending more time indoors. Dr. Albert Coe feels with increased testing now, as opposed to the beginning of the outbreak last spring, and contact tracing, Connecticut is better prepared to be in containment mode rather than just react.
The citizens of Connecticut really have taken social distancing and all the public health prevention to heart. And I'm not sure we really understand why that is and why Connecticut is different from Georgia or Florida or even Delaware, Pennsylvania.
And they stress that continued buy-in will be key.
I think November will be a period of risk. So my job is to make sure that we keep our discipline.
If you want to check out the full question and answer session, we've got a link on the Channel 3 app. Reporting in New Haven, Matt McFarland, Channel 3 Eyewitness News.